what's going to be the best way to manage this beast called diabetic neuropathy? Any given week, I see a lot of patients with diabetes. Me being a foot doctor, the number one patient that I see, the number one population that I see is diabetic patients. You know, one condition that is really difficult to treat as a foot doctor, not only me, a bunch of other foot doctors who I've spoken to, a lot of them, is something called diabetic neuropathy, which means you start to have like numbness and tingling sensations that are actually just kind of, some people have been described it as like worms being in their toes and kind of moving around. Some people say there are insects crawling there in their shoes. It's not really nice feeling, and a lot of people actually report a lot of like achy, like sharp shooting, burning pain during especially at nighttime. I actually hear that a lot. So as a foot doctor, I really want to be able to make sure that this condition is properly managed. And I have seen personally people's life being destroyed because of this specific conditions. So I want to be able to ask you what we can do with proper dietary habit, because I know with diabetes especially, diet is extremely important, yes?
Right.
So what's going to be the best way to manage this beast called diabetic neuropathy?
Right. So as we know, Dr. Lee, diabetes is one of the most rampant diseases across the country and across the world. And the most important part, it's modifiable, right? You can actually reverse diabetes, and you can do it through nutrition.
The person that comes to see me, I see probably about 20 to 30 diabetic patients every single day. Not even one single person knows that diabetes can be reversed. Can you tell me more about that also?
Yeah, so we know that diabetes is a problem with your blood sugar, right? Your blood sugar being too high, and then you have insulin resistance, which means that your cells are not taking in that sugar that it's supposed to, and there's a lot more sugar in your bloodstream than it should be. So, and that's a root cause to the diabetic neuropathy, right? Because if you have diabetes long enough, one of the side effects is that you're going to have that numbness, tingling, you know, pain down your feet or in your extremities. So one of the best things you could do nutritionally wise is to take this vegetable called bittermelon or MOMORDICA. And this is a popular East Asian vegetable, and it's used widely across different countries. And studies have actually shown that eating MOMORDICA in your diet or by a supplement actually lowers your blood sugar levels below diabetic, cutoff limits. It actually lowers your hemoglobin A1C levels, which is more of your long-term blood sugar levels, and it'll help reverse some of those symptoms of diabetes, like diabetic neuropathy.
Wait, if bittermelon and MOMORDICA is such a good thing, then why aren't more diabetic patients eating those vegetables?
Well, that's a great question, right? You would think if it helps so much, why aren't we eating? So for bittermelon, it has a compound called a polypeptide P, which mimics insulin, which helps bring sugar back into your cells and lowers your blood sugar overall in your bloodstream. So it's going to be super effective for diabetic neuropathy taken over the course of a couple months to a year, right? As with nutrition, it's a long-term process, but it's steady and stable. And as long as you're consistent with it, you're going to get results.
You know, one thing that I'll have to say is that, the primary care doctor, like family physicians or internists, they're spending a lot of time with you. When they see you, they spend a lot of time with you managing your medication, checking your health and everything like this. They sometimes do a good job telling them about diet, but it's not really that detailed. So people usually say, eat less carb, exercise more, which, that's not really that specific, but they don't really talk about, you gotta eat more bittermelon, MOMORDICA, things like this. So I think it's important that you do get some kind of dietary, like a wellness educations more, so that you know how to control your diet a little better. Am I correct?
Exactly. So yes, with every patient, I know diet is a huge hurdle because there's so much that we need to learn, so much that you need to know what to eat and not to eat. And that's why we highly recommend seeing a professional functional nutritionist or someone that is going to be able to help you figure out a diet plan that best fits your health needs. So for diabetics, we're definitely going to focus on lowering that sugar levels, right, to an optimal level, lowering those carb intake, and increasing more healthy fats, healthy proteins in your diet so that long-term your sugar levels stabilize.
You actually mentioned something that's really important, because I see a lot of, and I do speak to patients about their dietary habits, even as a foot doctor, for their neuropathic pain and things and whatnot. A lot of people think that, I should not be eating any fats because I'm diabetic. You know, people always said, but you said something really right. Eat the healthy fats.
Right. Yeah. So there is different categories of fats. So there's healthy fats and there's unhealthy fats, and that's just based on their biochemistry. So the unhealthy fats are what you can think of, right? Oils in fried foods, French fries, fried chicken. But the healthy
all my favorite
fats,
foods.
well, you know, we're guilty of that sometimes too, right, as doctors. But the healthy fats like olive oil, avocado, things like that, it actually helps bring down inflammation, helps regulate your sugar, increases your metabolism. So again, it's helping each step forward push you in the right direction towards your health goals.
Oh, gotcha.
Yeah.
Oh, that's actually pretty good.
Yeah.